hairlines add to your physical appeal. However, crown balding affects you psychologically. So when patients think that the doctor could not deliver in giving them adequate crown coverage, it sets him thinking and he gets disillusioned. And this disillusionment makes him wonder, so let's talk about whether this assumption is the truth or merely a myth. Subscribe to my channel to get frequent information about evidence-based treatment of hair loss that you can rely upon. Stay on. So firstly, I'm going to discuss what is the crown. There's a lot of confusion between the crown and the vertex. Are both the same or they're not? Secondly, I will discuss why there is a common assumption that crown results are not so good. What's the reason behind this assumption? And lastly, I'm going to take you through results of grade 3, 4, 5, 6 and also 7 baldness where crown results are shown, and I will discuss each and every result with you. Though the terms crown and vertex are used interchangeably, synonymously, but they are not the same anatomically. So imagine yourself wearing a headphone set and the strap, which is rather precariously balanced at the end of the head and it needs support, is where the vertex ends and the crown starts. Another analogy is the skull cap worn by Jewish people. It sits flush over the crown area. So this is the area of the crown. So to be relevant to the topic and without digressing from the main topic, the crown is the area that contains the swirl, also called as the whorl or the pinwheel or a spiral. The shikha of the Hindu is the central point of the swirl. A crown looks natural only if there's a center point where the skin is visible. That is the point from where the hair fans out in various directions in a whorl-like pattern, in a centrifugal manner. And this pattern determines the layout or the way the hair falls in the crown, the vertex and the shingling points. It is to be noted that the direction of the hair is in a clockwise manner and never anti-clockwise. So if there is a skin show inside a crown with thick hair, that is not a bald spot. That is an aesthetically acceptable normal crown and you're supposed to have in the center point of the swirl. Occasionally there might be two swirls like in this picture. Sometimes the swirl will be a little higher up, sometimes it is lower down, and other times it is a little eccentric, away from the center. Even if the crown area hair transplant is done with the same density as the hairline, theoretically speaking, it will not look the same. The hairline will continue to look denser than the crown area. So to understand why, you just have to imagine that you're standing in front of a forest. The forest looks very dense. And then you take a helicopter and start climbing up. As you climb up and go further, the trees will appear less dense. You can differentiate one tree from the other. That is because there is an illusion. A hairline looks naturally denser because you can see strands one behind the other and it gives you an illusion of fullness. Whereas in the crown, the illusion is lost. So this is one point. There is a common saying that the crown is the black hole of surgical hair restoration. Well, it actually is true because if our hair transplant is not judiciously or wisely planned, keeping future balding in mind, we may end up in a situation where we have consumed a lot of grafts, much like the black hole consumes planets. Because a time will arise when most of the grafts would have been used to fill up the crown with high density, leaving very few grafts for the hairline or for the ever-evolving baldness in the crown area. So to understand this point, let's do some mathematics. Let's do some calculations. You see this bald area in a grade 6 patient? The diameter of the bald crown, which is almost circular, is about 10 centimeters. So when we calculate the area of this baldness, it works out to be approximately 80 square centimeters. Now if we were to fill this up with reasonably high density, staying a little bit conservative and planting 40 grafts per centimeter square in this crown area, it will consume 3,200 precious grafts. Given the fact that an average grade 6 person has 5,500 lifetime grafts available, how many grafts do you think are left for his hairline, for his mid-scalp, his temple point restoration, and more importantly, for filling in the same crown area when it expands over time as baldness evolves? Even if we were to have enough grafts and fill this area up nicely, tomorrow when baldness progresses and the crown area becomes increasingly more in a centrifugal pattern, an outer ring will appear. Now this ring cannot be covered with very high density because by this time we would have utilized those remaining grafts elsewhere in the hairline or other areas. But if we do not afford the same density in this peripheral area, it will give an island of high density in a vast ocean of baldness, which will look so bad. The only way to cover that area would be to wear a hair patch or to shave off your head. So this is what most patients do not envisage, they do not think about. They plan their hair transplant in a hasty manner. They are fed with very wrong information on internet and by certain clinics which are driven by commercial goals rather than maintaining the trust of the patient. So you have to be very careful that too many grafts do not go into your crown area and you have a rain check for future use. So whenever a person comes to us, we note three things. One is the level of baldness and what is the likelihood of the baldness evolving, keeping in mind the patient's family history of baldness. This gives us his lifetime requirement of graft. Secondly, we need to know what is his lifetime availability of grafts, including scalp grafts on the one hand and body grafts on the other. And thirdly, whether the patient's expectations match what a hair transplant surgeon can scientifically deliver or not. If all these 3 points are optimal, only then is the patient fit for a hair transplant. This is very important. The crown is a moving target. We don't know how many grafts to commit in which area at what time of his balding process. So therefore, we have to be very judicious, conservative and deliberate in planning hair restoration surgery for the crown area. Now we'll go through some examples of grade 3, 4, 5, 6 crown vertex hair restoration. In this first grade 3 patient, you can see the coverage using 1800 scalp graft. Next is a grade 4 baldness patient in which 1800 scalp grafts were used for the crown cover. And this grade 4 Asian patient was managed conservatively using very few scalp grafts because we have to keep in mind his future requirements and also because he doesn't have much body hair available. This grade 5 Caucasian patient had a low density scalp donor with a very conservative approach because we also had to cover the hairline and the mid scalp. We used just 1000 scalp grafts for his crown coverage. Grade 6 baldness with 2200 scalp grafts used to cover the vertex. Another grade 6 with 2000 scalp grafts used. And in this Caucasian patient with ample supply of grafts from the scalp and the body, 1800 scalp grafts were used to give this result after 6 months. Now this last example is a case of grade 6 baldness of Indian descent who had no relative shortage of scalp grafts or body grafts and in whom we could give as many grafts as we wanted to. So you can see this nice result in a grade 6 pattern baldness. He has a head full of hair and there is no area which is left see-through. So if the resource is available, if the grafts in the scalp and the body are available, there is no limit to the amount of coverage we can give to the crown. But sadly that is not the case with the majority of the patients. I have a Skype call coming up and in the meantime till I attend the Skype call, please go through this playlist which contains a large number of patients of grade 6 pattern baldness in which crown and vertex were restored. Also the same videos are there in the description below. You can see them one by one. To receive frequent evidence-based information on hair loss treatments, advice you can trust, do subscribe to my channel.